welcome to the stage Caylee Noggle, Dr. Matt Hanley, Vicki Lewis, and Jeff Myers.
Well, good morning. Good morning. We're excited to be your first panel this morning and talk about partnerships and innovation, but backstage, I was just going to tell a quick story. I was showing Vicki some photos from a trip I just got back from. I try to do like one really hard physical challenge a year, and I just got back from hiking in Europe. And as hard as I tried not to think about work, you all know it's really hard to turn it off. So here I am hiking through, I might have been in Italy. We crossed through 3 countries at the time, literally thinking about how quickly and how much healthcare, and especially health policy, is changing right now. All of a sudden, my hiking partner falls down a hill. The landscape literally changed under our feet. She falls down backwards, down a muddy hill. She's okay. And it took us a minute just to stand there, laughed a little, like, number one, she's okay. She actually happens to be an employee of one of our hospitals, runs a surgery center. She was covered in mud. Half her gear was left on the top of the mountain. We're laughing, trying not to cry, and it was just so apropos of like, okay, how do we pick ourselves back up, adapt to what we now stand in, figure out how to use some teamwork to go collect like her hiking pole that is now like 20 feet above our heads that we can't reach. But it was just such a fitting and fun. I'll show you the pictures at some point. But it really was just kind of a fun analogy of kind of how we find ourselves here today. Set the landscape a little bit. Like, Georgia's really in a good place. You know, I'm sure we'll talk a little bit about the reconciliation bill, but Georgia is really so fortunate to have a strong network of hospitals that really know how to partner together, use teamwork, innovation to really advance healthcare for our patients across the state. And so excited to dive into those topics a little bit today. Vicki, I'm going to start with you and really all of you and just ask you about some of the exciting partnerships that are already in place within your organizations. And Vicki and I have had a number of conversations about one in particular that I think is so fantastic called the Kids Alliance for Better Care. So Vicki, tell us a little bit about that, how it came to be, and really how it serves your community down in Coffee County.
Thanks, Caylee. Kids ABC is really the brainchild of 3 amazing leaders in Georgia. Gene Sumner, who is the dean of the medical school at Mercer, and the leaders at Children's Healthcare of Atlanta and the Georgia Alliance for Rural Health. And what they've done is really try to improve pediatric care in rural hospitals and rural communities. It's a long way from South Georgia to Children's Healthcare of Atlanta. We all have a great deal of respect for Children's Healthcare of Atlanta, but they have used their many resources and their expertise to train our staff and our physicians, and very importantly, provide really game-changing equipment in our emergency departments and in our pediatric clinics. They've connected us with telehealth services to Atlanta and just made such a huge difference. I can tell you many heartwarming stories about families who formerly would have had to transfer their children to Atlanta and stay there with them. And we've been able to care for them in our community, and it's just really been game-changing. Just such a wonderful resource.
I think those types of partnerships, I think we'll continue to see more and more of those as hospitals look for ways to be sustainable and find new ways to provide care across their community. It's going to take those relationships. Jeff, you've got some experience in North Georgia. Y'all have really grown as a system over the last couple of years. Is that about right? And talk to us a little bit about like how that came to be and what that now looks like.
It really, we were talking about this a little bit before. It really starts with our boards and our community, and having the community integrated with your system and being able to hear the voices of what they need and what they're looking for. And the Hamilton healthcare system, which is now Vitruvian Health, has been very good for many, many years at making sure that we're heavily integrated and hear the voices of our community. And virtually all the things that we've gotten into over the last number of years have been in conjunction with or partnership with local employers, key players, identified needs, et cetera. So we really are remember the old term integrated delivery system? We're sort of the definition of an integrated delivery system in terms of all the things we're into. And it's a byproduct of we're here to serve our community. And I guess that covers that.
Matt, welcome to Georgia.
Good morning, everyone.
You 8 months, 6 months?
5.5.
5.5. Yeah. I'm giving you the benefit of the doubt, a little bit longer.
I'm glad you said 8 months, but it's 5.5.
5.5. So welcome. Well, how are you? And you're up in Gainesville, Northeast Georgia Health System. Talk to us a little bit of like what you're seeing up there already and how you're bringing some of your past experiences, both with physician partnerships and kind of some different payer experience that you have. Like, what have you seen worked in your prior roles that might be something that is ripe for Georgia?
Yeah, so that's a big question. I think I've been here 5.5 months up in Northeast Georgia, and to be honest with you, it's been incredible. It's been a delight, and I feel so fortunate to be up there. And as a health system, we have experienced a tremendous amount of growth, certainly in the last 10 years, and I would say in the last 2 years, we've had another big growth spurt. I mean, I've been here 5.5 months, and I've kicked off and opened, 2 new facilities already. And so what I have found is that we're a health system that has invested in a lot of things over the past couple of years, and we're at this moment, where we're ready to accelerate to the next phase. And so I'm spending a lot of time really thinking about what are the things that are going to be really important for us in terms of the future. And so what Jeff mentioned about this integration into the fabric of the community, that is something that is rich and alive and well in our health system. And we have to hold on to that tightly because we exist for our communities. And we often talk about we've got 11,000, 12,000 people who work at our organization, but then there's 2 or 3 other people who are families to those people who work in our health system who are integrated and work in the community. So that idea of integration is really tight. And so to your question about looking to the future, I think there's 3 things that I think are going to be really important for us moving forward. One is this idea of care excellence, so really, really being good at the core competency of care delivery. And there's maybe two ways to think about it. One is what I call is this excellent ordinary care. That's the stuff if you walk out and you talk to most people, that's the stuff patients will talk to me about. And you know what they are, right? Their experience, respect me, give me empathy, their access, there's care coordination, and then there's affordability, right? So those are basic blocking and tackling, but we need to do those extremely well, and we all have incredible opportunity. And then it's the stuff that what should we major in as a health system? And we're on that sort of intersection of, and we have majored in a couple things. I think people know about our cardiovascular. We have a couple other areas that we're good in, but I think it's important, certainly for us, to say we can't be everything to everyone. We can't do everything, and so being very intentional about the stuff that we want to major in is a question we have to answer. And then the second thing is really when you talk about physician partnerships, right, is focusing on making it a place where clinicians will tell their friends, so whether it's physicians or nurses, say, hey, you know what, this is a great place to work. I would love it if you came and worked beside me. And so to me, I'm very used to, from my past life, of being in situations where we really push down a lot of agency and accountability to the clinical leaders. I'm used to clinicians being on the hook for not only the clinical outcomes, but also the financial outcomes, the experience outcomes, the care coordination outcomes. And I think when we start to create those types of conversations in partnership with our administrative leadership, good things tend to happen, right? And so I think that's an opportunity for us. And I think the last part I would say is we just need to continue to be really good stewards of the health system in terms of being, I like to say the best run health system in Georgia, but, going back to what we talked about before is that we exist for the community. And our communities and our patients are our shareholders. So if they're looking to us for what's the return on investment that we've made in you, I'd like to be able to answer that question really, really well. So those are just some of the things we're talking about.
One of the places that from my role, see partnerships as being so critical, in addition to all of those, is around our workforce. And I know obviously we saw the hands of the students, but in terms of graduate medical education, I know we've got my friend from the Board of Regents here, and I saw our friends from Augusta University here and elsewhere, and how important really the partnerships are around graduate medical education. Can y'all each talk a little bit about what those partnerships look like in your community, how you're growing the workforce, and how reliant we really are on our partners across the state to help us develop and grow the workforce?
That's a really great question, Caylee. I feel like sometimes in a rural setting especially, we spend most of every day recruiting physicians and recruiting talented caregivers. So we've really taken a hard look at how to best utilize our resources, not only for recruitment, but for retention. And so to that end, we are starting an internal medicine residency program. And when we launched off on this program, we really, really had to look at partners. This is not something we had done before. We needed a mentor, we needed a leader, we needed someone who had been really successful. I mentioned Dr. Jean Sumner earlier. She has been nothing but a wonderful leader and example for us in graduate medical education. While it's going to be the Coffee Regional Medical Center internal medicine residency program, we needed an academic partner. We needed access to scholarly pursuits, to a library, for example. Those are just things that are not available to us. And so Jean has made those available. She also really helped us with faculty development. As you might expect in a small community, recruiting faculty, in addition to recruiting caregivers and physicians who can practice in the community, was a challenge. So it really helps. I think the partnerships have been invaluable. We also have a great quality collaborative with Emory University, and we've been very, very fortunate in that collaborative to sort of show our stuff, if you will. We had to prove to Emory that we could provide the kind of care to qualify for the collaborative, but they've had confidence in us. They've helped us develop teaching opportunities not only for their physicians, but, for example, for their CRNA students and others who've come to our community to get a rural experience. So all in all, our partnerships have been invaluable.
Jeff or Matt?
I'll go. So we started our program about 5 years ago now, and it's internal medicine and family practice, and we've got about 55 now that are in the program, which is terrific. And maybe sort of the journey towards how we went about going into it. I had previously worked at an academic facility and saw the benefit of what it does for your existing physicians, the challenges that are there, because it's young minds challenging you constantly on everything you're doing. And we had 50 years of being a community hospital, wasn't sure whether the medical staff was quite ready to take that on. And so it was one of those things that was very important to make sure that we had a sense of, are they really going to support this? Are they really going to be engaged to make this successful? And I was so proud of our medical staff. They were all over it. And we've had comments along the lines of, it's the best thing we've ever done. Because every year you've got a new crop that are coming in with different perspectives, different ideas. And the journey, I'm not going to say it was easy, because it was not, but I could not be more proud of the organization in terms of the embracing of that. And one of the things we did was we took some apartment complexes that were in need of upgrading. How's that? And we renovated those and gave the housing for them to be able to be with us. And that was amazing. So they're on campus, and they're adjacent to what we have, the Bradley Wellness Center, which is a large workout facility, and so they've enjoyed that, and they can literally walk down to the hospital from their place. So it's really worked out well that way, because they have to work so hard and they have to put so much time in. Time is probably the most important commodity for all of us, and that has been one of the things I think that's been beneficial for our program. But it was terrific.
Matt, y'all needed a lot of new staff to open up new towers, right?
We do. Going back to the GME question, we are now entering our 7th year, and so we started in 2019, and this year will probably have somewhere over 230, both residents and fellows in our organization. We expect that to be north of 250 in 2027. And it's not been a journey that I obviously have gone on, but I certainly have heard the stories of how hard that was initially. It was a 10-year journey to really get the support of the community, and I think the physicians, too, that journey is well known, but today it is gaining momentum. People love to come up, and part of that journey has been the opening of the Green Tower, which we opened just under 1 million new square feet, 11-story tower, and it houses our level 1 trauma center, and then obviously a lot of staff to support all those programs. I would say, in the grand scheme of things, I feel very fortunate with where we sit in Northeast Georgia in terms of our nursing and staff. So do we have some opportunity? Yes. But when we look at where we sit, because some of the workforce development stuff that we did, our turnover is nearing the top decile, and our nurse vacancy is actually lower than it was prior to COVID.
Wow.
So we feel really good about that.
Wow, congratulations. Jeff, you mentioned the importance of your boards and community a little bit. When some of these new partnerships, how do those conversations start? What level of buy-in was required of your board, of the community? Did they stem from, as Russ said, trying to solve a problem, to meet the needs of the community? Tell me about evolution.
Kind of ready, fire, aim. We're a secondary market, the carpet capital of the world, and now we're really the flooring capital of the world. So it's a very interesting, it's kind of the Silicon Valley of flooring. The best way I could describe it. And I grew up in Silicon Valley. At least in Silicon Valley, everyone was doing something different. In Dalton, everybody's doing the same thing. And it's really kind of dynamic. So you never know where something is going to come at you. And we have representation from, obviously, the flooring folks. So we're constantly hearing from them what their needs are, one direction or another. And then individuals have passions for what they want done. And Anna Shaw, I think we were going to mention.
Yeah,
you want me to
talk
mention
about that a little bit, the Anna Shaw Autism Center.
Yeah, this would be, if you've ever heard of Mr. Shaw, Shaw Industries. He's a very interesting fella. He's a great guy. He's 94 and still goes to work every day of the week, 5 days a week. And he is one of the most competitive human beings I've ever met. He's amazing. So we had one conversation. He has a grandson that is on the spectrum. And he said, his family has to go either to Atlanta or to Nashville for care. We had one conversation. He asked me why we hadn't already done something. And I said, well, it's really not sustainable. We're in a secondary market. And went through the challenges about why it's so difficult to make that happen. And then we had a second conversation. He came back and he said, I'm going to give you an endowment to cover the losses that it's going to take you to be able to do this. And he said, you have 18 months to have the building built. Which second conversation, went back to the board, had the dialogue about what could be done, and we've got this endowment that could make it happen. They said yes. I went back and said, okay, we have a deal. And 18 months later, we opened up. So, when you say, how did that, and it's amazing.
I've been there. It is amazing.
Yeah.
Congratulations on that.
That's actually a perfect example in terms of working the community together. So we had 18 months. So we put the architects, we put the lead staff involved with it, and we brought in the families from the community who had kids who were on the spectrum at various different levels, and they together, while it was being built, designed this building. And so there was feedback in every direction on what their perspectives were in terms of what it would take to get it done. And if you get the chance, and if you want your heart blessed, come up and walk into that facility, because it's so much fun. I love it.
Everybody should go visit Jeff. Our leadership team visited his campus, and it's truly amazing. I think especially the Autism Center. It's really an example for all of us of what can be accomplished with your community support. So congratulations.
Thanks.
Vicki, coffee is a different community, completely different than up in North Georgia where Jeff is. Can you talk a little bit about, as other folks might be considering partnerships or pursuing innovation, maybe just things to watch out for?
Yeah, that too is a really great question. I think in a community setting, we have a choice of heavy lifts, and each year when we're doing our strategic plan update, we decide which of those heavy lifts we're going to try to accomplish. One of the most successful partnerships that we've had really was born out of a need. We have an extremely busy intensive care unit. We knew that we had to up the ante on the physician care and provide intensivist services round the clock, and we simply couldn't afford to do that. So with the help of then Senator Dean Burke, we really accessed some Georgia Board of Healthcare workforce funds and worked with Emory to bring EICU to our community. It's a second set of eyes, but it's also a blessing. It has, again, helped us provide excellent care close to home, but it's forged a partnership with physicians and caregivers in ways that we never could have imagined. It was a very heavy lift. It took about a year and a half just to establish the connectivity between Coffee Regional and Emory. We had a lot of great partners, obviously Dr. Tim Buckman, Cheryl Hiddleston, two great leaders in the intensivist program at Emory, helped us immeasurably. We know we've saved lives. We know we've improved our patient care. And a very heartwarming story is out of that came a life-saving event because we had a patient in our ICU on the EICU who needed ECMO. And most of you know we're 3.5 hours on a good day from Emory. And the Emory team came down in the middle of the night to help us save this patient's life. And I know Emory has used that as an example with their leadership team, and we certainly have too. It was truly a collective effort of clinical partners. We do not have any kind of asset sharing arrangement with Emory. This is truly a compassionate and clinically driven partnership that's been invaluable to us.
That's a great story. Matt, you've worked in several different states. I don't know if I told you I was going to ask you this question, but thinking back, are there types of partnerships that maybe haven't worked so well? Maybe some things to watch out for or just be mindful of as folks are talking about how we continue to create connectivity and partnerships?
That is a great question, and no, you didn't tell me.
Sorry.
You were gonna ask me that question. But it's a great question. So I'm actually that brings to mind a couple partnerships that did not work well in my past, and I think you have to be, really intentional about the problem you're solving for when you go into a partnership. And I think but sometimes partnerships start with people having a solution rather than the problem. So I think as an organization to really get clarity on what is that problem you're solving, and it takes time to get clarity. So I think driving it to the ground, and when you miss on that, or you don't get also clarity from the other party in terms of what the value that they bring, what happens is you come up with the wrong value proposition. And the rhetoric may be one thing, but in reality, what pans out doesn't ultimately meet the needs of either organization. And then the other thing I think I have seen too is this is an example, as a health system, you go out to solution for extra services or certain capabilities that your organization may need, or you decide that that's not a core competency, you want someone else to do it, is you have to get really, really gritty and granular and get underneath the weeds to understand whether that partner can actually provide those services. because there's a lot of people who speak, who talk a good talk, and I think until you actually get down into the weeds and talk about the processes and show us the workflows, talk to people who you've partnered with before, I've seen that miss. And so that would be another potential example.
Something to watch out for.
Yeah.
We've talked a little bit about partnerships. Certainly innovation is not necessarily mutually exclusive. Are there areas that, either clinical or administrative, from your lens as CEOs of really successful systems and hospitals, that you feel like are ripe with opportunity for innovation, or where you see innovation coming next?
Absolutely. I think that there's a lot of opportunity around connectivity, and certainly the electronic medical record. One of the challenges that rural hospitals have is providing primary care and providing a lot of care in the communities, but also needing to transfer patients to academic medical centers or tertiary and quaternary centers for care. The electronic medical record connectivity can be challenging. Lots of us in rural settings don't have Epic. We are on other platforms, and so it's not only a challenging for our opportunity for our patients, but it is for our caregivers as well. So what we would really like to see is some kind of universal connectivity for the electronic health record, something that makes sense, something that's easy to use, and I think can serve as a resource. We're all trying to use AI and ambient listening and some of the things that we bolt on to the platforms we have. But for us in a small community to access platforms like Epic would be a game changer.
I hate technology. I'm old, and I can't keep up with it all, and it's all very expensive. I mean, I want to go back to paper, but I don't think I'm going to succeed. There's opportunities everywhere, and what I love about healthcare is there's so many different opportunities to be able to serve, and there's so many different opportunities to be able to do things differently. We're an incredibly inefficient delivery system, just in the aggregate. We're an inefficient payer system, so the opportunities for improvement are virtually everywhere. It's, do you have the ability to be able to identify it sufficiently, get buy-in, make sure it's sustainable in terms of the changes that you're talking about making. One of the tests I heard some time ago was if you think people are really receptive to change, get your partner to switch sides of the bed and see how well that goes. And then let alone implement an EMR system, et cetera, in terms of thinking it's going to be really well received. So, generally speaking, people like change as long as it doesn't affect them. I sound really pessimistic, don't I? But that's where the challenge comes in terms of the buy-in. The opportunities are there, but you've got to get the buy-in and address the why. Why are we doing what we're doing, and how is it going to improve lives, generate more efficiency, et cetera? And so generating that excitement and commitment and endurance towards achievement, and you have to be a little sick, but that's kind of the fun part. But, I guess that's what we do.
Yeah, that's great. I think a couple things about innovation. There are a lot of shiny balls in healthcare, and listen, we have our shiny balls, and some of them are amazing. So we did have I literally talked to hospitals 2 weeks ago, and we're implementing inpatient ambient listening, and a hospital said, I'm going to give you my conservative estimate, but this is saving me 20 hours a week. It's amazing. That's real innovation. But I would also challenge, I challenge our system to say, listen, there's a lot of stuff that we can innovate in terms of how we do things. So we already have technology in place for, open access scheduling. Where are we on that? Are we at 50%? How do we get to 70%? Where are we on basic patient experience? How hardwired are the behaviors that we've known for the last 25 years that work really well, right? How consistent we are on some of the evidence-based medicine that we've known for 10, 15 years in terms of delivery. And so, you get a 10% bump in those things that are all knowable. And innovate in terms of how well you're able to do things and how fast you can make change. To me, that's also innovation. And there's a lot of low-hanging fruit, when I talk to our teams, and a lot of low-hanging fruit in healthcare that I think we can really move the ball.
I wouldn't be doing my day job if I didn't pause and talk a little bit about opportunities that are coming with the Rural Health Transformation Fund. For those of you health policy nerds out there, like me and a few others that I know that are here, NOFO, the grant opportunity notice came out earlier this week. It's about 120 pages from CMS and filled with opportunities on how we might support rural health transformation in this country with an infusion of about $50 billion. Lots of different ways that this money can be used, and we're all coming up with ideas. Vicki, you're a true rural hospital, right? Like, you are who this kind of program is designed for. You are fighting every day to find ways to, number one, serve your community and your patients, and number two, be sustainable. What are you hoping to see out of this fund? What are the types of projects and funding and grant awards that you are hoping to come out of this?
First of all, I applaud the GHA for their transformation platform. It's truly outstanding. I commend it to all of you to read. It provides just really an in-depth understanding of the challenges of rural health care. So great job to the GHA and Caylee and her team. The most important things to me, and when I've read the platform several times, are access. I think each of us in rural communities every day have the challenges of making a bottom line, and we hopefully are pretty successful at that. But over and above a bottom line, we need capital. We need capital to support the infrastructure, our bricks and mortar, our technology, and just the things that we need within our buildings to care for our patients. So that is really important. And I think that under access, in addition to physical facilities, there are just all kinds of opportunities for us around workforce development, around data collection, and very importantly, around outcomes. We want to provide great care to our patients. We work every day to bring the outside in. And I think some of the really important opportunities under these grant opportunities that Caylee's speaking about are to fund bringing the outside in. It's replication. We're not going to try to reinvent the wheel around cardiac care. We're not going to try to reinvent the wheel around neurology. But we do need to bring the outside in. We need those outcome criteria to be available in the rural setting. And that's what I think that GHA has done a really beautiful job of outlining. Most of us can keep our doors open if we can support the volumes to support our bottom line. And the way we support volumes is with the support of the community, the loyalty of the community, and sharing the great outcomes that we can provide. We can provide excellent care close to home with the support of this kind of partnership. So I'm truly excited about the opportunities.
Well said. Jeff or Matt? Maybe not.
I'm going to praise her. She's fantastic. We've been friends for a number of years now, and she has a passion and heart for her community like no other. And it takes that. From a leadership standpoint, it takes that where you wake up every morning and you're thinking about your community, you're thinking about your organization. When you go to bed at night, you wake up 2 or 3 in the morning, and you're still thinking about what went on the day before and what you're facing in. And she is one of those leaders that represents that deeply and well, and kind of like her.
He's too kind. Jeff's got a lot of things going on up in Dalton. So again, I urge you to go visit him.
Yeah, I think. And kudos to both of you. Clearly, great leaders for both your communities. I think the other thing I would add is, for rural healthcare, it's just a recognition that we can't hold the same standard of a business model as a health system that's got 10 hospitals, right? Because there is a fixed cost of readiness in a community, right? And you hear the sort of story that always comes to mind is, we lost an OB provider and we had to shut down the OB plan, right? Or I can't afford anesthesia in a rural community because we don't have the volume. So I think one opportunity is just think about what is the readiness cost, EMS, fire, police, it's the same thing. What's the readiness cost to have the service readily available in a community? And I think if that's one area that comes to mind, in the distribution of expertise. So if you have the expertise that can be distributed and available, I think you can have communities reinvest. I mean, certainly for us, our example is Habersham Hospital. That was a couple of years ago, really on the brink of going out of business, and we were able to partner, and they became part of a Northeast Georgia health system, but we reinfused some capital. But a lot of what we did was reinfuse standards and expertise, and now what we're seeing is the community building back trust in that organization, and it is busier than it has ever been. And so great example of people rebuilding trust in the community, and for something that's really, really important for the people who live there.
I think that's well said, too. I lived through that with a different hat on at the time, and that was a really big deal. And it was really, really powerful that you were able to partner and save that access to care for that community. With the risk of going over and making Mark and Russ upset with us, we're going to call that it. Thank you to Jeff and to Vicki and to Matt for what you do, not just today, but every day to provide care for Georgia's patients. So thank you.